few years ago, I joined an overseas contracting company. Then I started building the embassy in Turkey. And I woke up on a Tuesday morning and my whole body was swollen. I'd blown up like a balloon, so I went to the hospital and they said that my kidneys weren't working, my liver wasn't working, and I had heart failure.
His brother, Eric, who's working for the same company in Beirut, he called. It was really scary. I pulled over and I said, "Is Chris still alive?" You know, he just couldn't tell me. Anyway, so he said, "Well, yeah, he was alive, but he was in congestive heart failure and liver failure and kidney failure." And I just want my son out of Turkey yesterday.
Here's this young guy who's having the biggest health scare of his life, and he's at risk. How scary is that as a mom, to think you might be losing your kid? He's across the world. You can't get to him. You can't help him. All you can do is make some phone calls.
Finally, a cardiologist did an echo and thought it was his aortic valve and said they could do a valve replacement there, but we weren't really interested in that. And Chris was really too sick to worry about it much. The transfer center at Swedish was amazing. They were so helpful, and they just told me to let them know, when he would be coming in. And when I did know and called him back, they knew about his flight. They had already been in contact with the people who were medevacing him.
So I'm working out of the Swedish Transfer and Operations Center. It's really the command center of the whole Swedish system. When we looked at Christian coming in, he's taking a medevac flight from another country, right? And you're like, okay, when is that plane gonna land at Boeing Field? When is that ambulance gonna get him here? That might be midnight, it might be 2 a.m. So we need to know ahead of time that we've staffed for a patient coming in at 2 a.m. So the transfer center RNs are coordinating with the charge nurses and the nursing supervisors on that hospital system to make sure that we are ready for you when you land and when you get here. And that's where the GE tiles come in, because you can say, we're gonna place him here, we're gonna block this bed, we're gonna hold it for him, so that anybody looking at the system goes, oh, we have staffing and we have a bed for him.
He got on the plane and it was just perfect from then on.
I was really happy to be there. They wheeled me in and admitted me to the hospital and then operated on my valve on a Friday. And I think I was up and walking around on Sunday. So very thankful to be who I am and be able to do the things that I like to do, because it can get taken away in a minute. But I have a chance now to recover and continue living my life.
It was overwhelming relief that he finally made it somewhere I felt he would get help, and he did. I can't thank any of them enough.
When a patient is sick and in need, what they want is their physician and their nurse to be able to be with them and sit with them and listen with them. That work is sacred, and it's been the same for 100 years, and it'll be the same in 100 more. But in order to be able to provide that, all of the outer workings, the operations, the technology, all those things have to be seamless and flawless in how we operate. And so the GE tiles have helped us do that. It was a generous donation from philanthropy that allowed us to make that first, toe into what this mission control can and will be. But it's just the start. The leadership team at Swedish already is looking at those GE tiles for information many times a day.
I've seen this technology in real time help patients during the pandemic, help patients when they're having a heart attack or a stroke, and help patients in those transfers get access to our system in a more timely fashion that truly did save their lives.
In the future, if you have sepsis or if you have congestive heart failure or whatever the condition is, we'd love to be able to monitor your condition in real time across the entirety of Swedish and make sure in real time that people are getting the care they need. It's been awesome to be in Seattle and have so many partners locally who can help us grow and develop our ability to know and to meet those care needs in real time, but that's where things are going, and it's an exciting time to be in healthcare.
Personally, it feels amazing and hopeful and inspiring. But we really have outgrown our space, and the critical need to grow into a larger space so that all of the team from the operations center can be together could not be more acute. Without philanthropic support, we cannot take the GE tiles, we cannot take the STOC, we cannot take mission control to the next level. It's absolutely essential for our ability to serve our mission, which is to serve our community.
Swedish was started with donations, 110 years ago to meet the community's need. And it's, we're coming back to our roots in some sense because we're getting donations to once again meet the community's needs. So I'm just super happy to be, the temporary baton holder and part of this long tradition of support.
The STOC is a technology that is central and essential to everything that we do. It is our #1 philanthropic priority this year. This will save lives.